I hate being stuck behind podiums, so I'm going to come out a little bit to talk to you all. It is an honor and a privilege to be here at AHS. Very excited we could get it going and have another conference. So today we're going to talk about obesogens, but before we go there, we're going to go back 2 years real quick to the Ancestral Health Symposium 14. Did anybody hear my talk on methylation at 14? Okay, so some people. So at Ancestral Health Symposium 14, we talked about methylation and methylation defects. We're just going to take one moment. The central riddle that I posed is, if methylation defects cause health problems, and they do, why are the genetics still relatively prevalent among populations? If they cause problems, they should be weeded out. But they haven't been. And why? And I didn't know. I still don't claim to know, but I have one piece possibly of the puzzle now. So this lactobacillus species, CD6, was found to produce activated folate, the methylfolate that those mutations stop human beings from making. So could the right gut bacteria make the fact that you have methylation mutations irrelevant? Possibly. Also note at the very bottom, it was susceptible to many antibiotics. So is it that people with these genetics who used to have good gut bacteria did not have problems, but now in the age of antibiotics, they do? I don't know. Interesting point. But let's get on to 2016. Today we're talking about obesity. Here's your obligatory picture of some fat people. When we talk here, we have a little bit of a leg up, and we talk about environmental mismatches as being central to the reason for obesity. And of course, we talk about food as being one. We also talk about movement patterns being discordant. We talk about sleep being an issue for people. We talk about stress being a concern. And we also talk about dysfunctional social patterns. So do all of these contribute to obesity and disease? Yes, I believe they do. Some other issues that we have broached in the past include the gut microbiome, one of my favorites, and also methylation and epigenetics, which we are also going to talk more about today. Today, however, our focus is on this. So it has been estimated that we are putting out trillions and trillions of pounds of chemicals every year into our environment. In fact, in the past 100 years, we've gotten really good at making stuff and putting it out there. And according to the European Union, 99% of these chemicals are under-tested before they're released into the environment. Today, we're focusing on something called EDCs. I can't even look up at that. Endocrine disrupting chemicals. Maybe being out here is not the best idea. All right, there we go. So endocrine disrupting chemicals. Better? Everybody hear me? Yeah, cool. All right, so let's break this down. So endocrine disrupting chemicals are defined as exogenous. That means they come from outside of your body. Chemicals or mixes of chemicals that can interfere with any aspect of hormone function. So just so you know, endocrine is the fancy way of saying hormones. So these are hormone disrupting chemicals. Now we're going to focus for a moment on things that cause direct endocrine disruption. And we're going to talk about PCBs, otherwise known as polychlorinated biphenyls. They were invented in the 1880s. By 1930, they were known to be toxic, and the US banned them in 1979, so about 50 years after we knew that they were really toxic. They're often used in, were used in heavy-duty electrical equipment like transformers. And we're going to talk about one particular case. This was not my patient, but he is in the literature. He was a 65-year-old male. He was involved. He was one of those guys who worked on that heavy-duty electrical transmission. He presented with peripheral neuropathy, which means nerve pain of his trunk and arms, which is a very unusual presentation. He had acne, headaches. He was an insulin-dependent diabetic. He was obese, and his fasting glucose on insulin was 306, which is terrible. Now, it's important to know that whenever he tried to lose weight, all of his symptoms got worse, right? Now, normally we tell diabetics they need to lose weight and their symptoms tend to get better, but not this person. Why? Well, we find another study of 45 obese women, and it was found that when they lost weight, after 6 months of weight loss, the amount of PCBs in their blood went up by 50%, right? So a lot of these things called persistent organic pollutants, or POPs, are stored in fat. And when you lose weight, you liberate them from your fat back into your system. So this gentleman who was poisoned by these PCBs, whenever he lost weight, it made it worse. We also see in a sample of Portuguese obese patients, these are guys who had bariatric or gastric bypass surgery. They found, first of all, that 96% of them had these POPs in their blood. They found that the more of these they had in their blood, the more correlation there was with hypertension or high blood pressure and dysglycemia or diabetes, right? So could one of many, of course, reasons that some people who are obese have high blood pressure and diabetes while others do not, could it be in part that they have more of these compounds in their bodies and in their fat? It's a possibility. Interestingly, they found that the higher these POP levels were, the less weight these people lost. So, are people, anyone out there who is working with patients, are you counseling your weight loss people that they need to do detox as they're doing weight loss, right? Should people undergoing gastric bypass surgery also be counseled that they should be doing some detoxification? I believe the answer is yes. So, getting back to this gentleman, 2 years later, he underwent a detoxification regimen between the age of 65 and 67. All of those symptoms resolved. His neuropathy went away, his insulin dependency went away, his diabetes went away, he did lose weight, and his fasting blood sugars returned to essentially normal, right? And that is simply by getting these endocrine disrupting chemicals out of his system and allowing his body to work normally again. All right, so the Endocrine Society published a scientific statement on endocrine disrupting chemicals. You can go and grab it if you want, but it's interesting the different conditions that were linked to these endocrine disrupting chemicals. So for all the ladies out there, PCOS, premature ovarian failure, uterine leiomyomas, which is a fancy way of saying fibroids, and endometriosis have all been linked to these compounds. So anyone you know who has PCOS, fertility issues, fibroids, or endometriosis, part of that issue may be these compounds. Also, breast cancer has been linked to it. Guys, we don't get away either, so falling sperm count, testicular cancers, and prostate cancers are all linked to these compounds as well. And it gets better. It doesn't stop there. We've got a whole nother page, too. So Chris Kresser just gave a nice talk on the HPA axis, right? But these compounds have been shown to disrupt the HPA axis. So could part of your adrenal fatigue, whatever you'd like to call it now, be because of these compounds? Possibly so. Thyroid dysfunction. Again, it's not just all Hashimoto's disease that's out there. And we're going to talk quite a bit more about obesity here. There we go. So this little messy drawing is one I put together on endocrine disruption in the thyroid. So in between all those scribbles in the center is the thyroid chain, and all those red words there are all different chemicals that disrupt different stages of thyroid function. So literally every stage of thyroid function, from your brain all the way down to the nuclear receptors in your cells, can be disrupted by these compounds. So again, not all thyroid dysfunction is Hashimoto's. Okay? So that's direct endocrine dysfunction. Now we're going to get into indirect endocrine dysfunction, because this story gets better. So most people view fat cells as like these storage sheds. You roll up the door, you slide the calories inside, and you roll it down until you need them again, right? But that is not at all what fat is. Fat is a true endocrine organ, just as much as your thyroid gland, your adrenals, and any other hormone-producing part of your body. And because it is an endocrine gland, it is susceptible to these endocrine disrupting chemicals. So we're going to get into now a subset of EDCs called obesogens, and these are endocrine disrupting chemicals that specifically promote obesity. And we're going to talk about how they do that. So here's a big giant block of text. We'll break it down for you. So the very simple piece is obesity occurs when energy intake exceeds energy expenditure, right? So calories in, calories out. But again, not that simple, because individuals vary widely in their ability to gain weight when they're overfed. Some people gain weight very easily. Some people don't gain weight pretty much no matter how much you feed them. Why? Well, the study suggests that obesity is largely programmed during early life, including when you were in your mom's belly. And that kind of sucks, right? So, studies have shown that excess levels of estrogen or cortisol in the womb or during early life resulted in increased susceptibility to obesity and metabolic syndrome, right? So could the reason that you have metabolic syndrome or obesity, despite the fact that you eat well and exercise, be because your mother was very stressed out when she was pregnant with you? Possible. Okay? So we're talking about the environmental obesogen hypothesis, and it says, look, these chemicals come in early in life, and they mess with us, and they increase your fat mass and your risk of obesity. So the way they've been shown to do this, they alter the epigenome of your stem cells. In other words, your stem cells can choose to go down one path or another, and these chemicals come in and they knock your stem cells down the path of becoming fat cells. So you are biased to have more fat cells. Now, interestingly, this has been shown to occur most strongly in bone. So it's been shown that exposure to these chemicals turns cells that would become your bones and makes them become fat cells instead. So we talk a lot about osteoporosis, which is a big deal, and we talk about the dietary piece and the exercise piece, and those are really huge. But could part of the issue, again, be what you were exposed to during your life or even when you were in the womb setting you up? So we talk about fatty liver and fatty pancreas, but also fatty bones. All right? So this process results in a higher number of fat cells and potentially a lifelong struggle to maintain a healthy weight, which is made worse by all these environmental factors that we talk about. So, to sum up where we are right now, we have direct disruption of hormones, including thyroid, insulin, estrogen, testosterone, and many others by these endocrine disrupting chemicals. And then we have an indirect mechanism by the diversion of stem cells into fat cells, both of which can predispose towards obesity. But sadly, it gets worse, right? So they did a test on mice, and they exposed them to BPA. You may remember BPA is the chemical that they talk about in plastic water bottles, and a lot of the bottles now say BPA-free. BPA is a xenoestrogen and a potent endocrine disrupting chemical. And it's good to know that they've replaced it with BPS, which on preliminary tests is just as bad as BPA. So, awesome. So they exposed mice to BPA or estrogen when they were developing, right, as little bitty mice or as when they were prenatal. And then they tested them. And what they found is that females in particular who'd been exposed to BPA, their respiratory quotient was off, which meant that they were metabolizing carbohydrates rather than fats. So we talk a lot in the kind of paleo movement, you should be a fat burner, you should burn the stored body fat on your body, but we found in these mice that these chemicals biased them away from it, so they couldn't do it if they wanted to. Now, interestingly, also, during the dark cycle, and it's important to realize that in mice, night is day for them, so they're supposed to be active when it's dark, they found that the mice who'd been exposed to BPA and estrogen were significantly less active than mice who didn't, right? And the real bitch of it all is that males didn't have the same issue. So this seemed to be a female-dependent thing, right? Not fair. Okay, so results suggest that the females who were developmentally exposed to BPA exhibited decreased motivation to engage in physical activity. So you know when you really don't want to move around very much and exercise, it might not always be your fault, okay? So we realize now that we have direct endocrine disruption of all these hormones. We have indirectly a diversion of stem cells into fat cells. We see a disruption of metabolism and a bias towards carb burning, a disruption in the motivation to move, and a dysregulation of the neuroendocrine control of appetite and body weight. So it is not just all about what you choose to put in your mouth and how much you exercise, okay? The bright spot, if you will, is that genetics also seem to determine sensitivity. So this was done on school-age kids, and they were checking the kids who had been exposed to pesticide exposures when they were prenatal. And they were checking their body fat, their blood pressure, and some hormones like leptin, glucagon, and plasminogen activator inhibitor 1, just so you know. Well, they found that certain mutations of the PON, man, my brain just fled. PON is an enzyme that breaks down and detoxifies a lot of these compounds. So if certain kids with certain mutations, it was found that there was no biomarkers associated, so it didn't seem to affect them. While other kids with other mutations, it definitely did seem to affect them. So again, it is also about genetics. So some of us luck out if we have the good genetics to deal with these compounds. They'll affect us a lot less significantly than those of us who got the short end of the straw on that one. Now, the really, really bummer news is that this is transgenerational, right? So the consequences of exposure have been shown to persist through 3 generations. So we talked earlier about, could your issues with blood sugar regulation and weight be the consequence of what happened when you were to your mother when you were in her womb? But now it says, could this have happened to your grandmother, right, when she was in the womb or a young child, and that's cascading down to affect you? Nice. So what can we do about it, right? I'm a huge proponent of preconception care. Now, when people come to see me and they want to get pregnant yesterday. And so when we tell them that they really should take 4 to 6 months to prepare themselves to get pregnant, most women say, no, thank you. But when we start to understand some of the consequences and long-term consequences of some of these things, it doesn't seem like a big deal, to me at least, to take a few months to prepare yourself for something that could affect your grandkids down the line, right? We need to engage in sensible avoidance. Usually when we hear these things, we think like this guy, we want to get on a gas mask and a chem suit. We cannot fully avoid these things, but there are sensible steps we can take. I recommend everyone check out the Environmental Working Group, ewg.org. They have a very nice little article on the dirty dozen endocrine disruptors, what they are, and ways to avoid them, okay? There are some sensible steps that people can take to minimize this. I'm also a big fan of detoxification. So if you imagine your body is the bucket right in the middle, we have what goes in. So by sensibly avoiding things, we're reducing what goes in. We need to increase the amount that our body is able to detoxify and get out, thereby decreasing the body burden or what stays inside. Again, the long-term goal is that we reduce what goes in, we increase what comes out, and we decrease what's left. The overly condensed version of how to start doing this is to, 1, limit your exposure. So go check out that EWG article and see what you can do. Eat a nutrient-dense diet. Protein is necessary for detoxification. Also a big fan of the cruciferous vegetables like broccoli, for example, alliums like garlic and onions. They both contain a lot of sulfurous compounds that are incredibly beneficial to the liver and the detoxification process. Drink enough water. The use of supplemental nutrients and herbs can be extremely helpful. We do need to pee and poop regularly. That's the way we get it out of our body for the most part. And there's something called enterohepatic recirculation, which I don't have time to go into today, that we need to deal with. How are we doing on time? 12 minutes? Dang, I really sped through that thing. All right, well, I guess we have a couple of extra minutes then. Let's go on and we can cover a few pieces at the end. All right, so in summary, folks, endocrine disruption is a real and a serious problem. The conventional medical community tends to think that this is junk, that there's nothing that's really here, that there's nothing that needs to be done. You hear it all the time, we don't need to detoxify, we already have detox systems in our body. And that is absolutely true, that we have detox systems in our body. Now, some of us genetically are extremely good at detoxifying, and some of us are extremely bad, and those tend to be your multiply chemically sensitive people, and they need a lot more help, right? But the science is clear and growing clearer all the time that this endocrine disruption is a real and significant problem for people. It is not the sole cause of obesity, but it certainly is part of the issue. I see people all of the time pulling their hair out, very frustrated, because they're eating well, they're exercising, they might be sleeping appropriately, they might have their stress under control, and they're not getting the benefits from all of that activity that they should be. Now, there's a bit of doom and gloom to this because some of it is pre-programmed before you were born, but there's still a lot that we can do ourselves. So, we all need to avoid what we can. We need to detox as much as we can, and preconception care is absolutely critical. We also need to take collective action. So, there's only so much that we can do as individuals to avoid these things. But as societies, we can mandate that we should have better testing of many of these chemicals before they're released. So for example, I mentioned BPA was phased out solely because of consumer demand. People weren't buying plastic water bottles, so the industry scrambled to find an alternative. Now, because chemicals are still far under tested, they grab BPS, which again, preliminary testing is saying is just as bad as BPA. So we, as societies, need to argue what, there's a great talk that's going to be on sustainability and how we have to work for sustainability in our food chain. We also have to work for sustainability and overall health and wellness in many other areas, and one of which is that we can't just make something, put it out in the environment, and then say, whoops, that was a bad thing to do. For example, those PCBs that were outlawed in 1979 are still around, and they bioaccumulate up to 1 billion times in human bodies, right? It's also important to recognize that human infants are the very top of the food chain. So we're at the top, and then our babies who are breastfeeding off of us are even farther up. All right? So I urge people, where they can, join the environmental working group. They have petitions. We need to lobby for stronger regulations, right? Let me close this piece by telling my orca story. So I live in the Pacific Northwest. We have a resident pod of orcas who live there with us, and they feed on the salmon in the Puget Sound. Now, last year, an interesting piece came out in the newspaper saying that these whales were in trouble. The reason? The salmon were at a historic low. So you think, the whales are going to starve. That wasn't the thing that had marine biologists concerned. The concern was that with low food intake, that they were going to start drawing on their fat stores, and they were so polluted by these persistent organic compounds that they were going to poison, weaken, and essentially die. So it wasn't that the whales couldn't survive a low food intake for a while. It was that they had become so toxic that they were going to poison themselves. We've seen that 96% of obese people in a small study have these compounds. I can guarantee that every one of us sitting in these rooms have these compounds. It will affect some of us more than others, but all of us need to take steps as individuals and collectively to try and change this. All right? It seems I've finished my talk early. I would love to take some questions. Thank you so much.
Tistis, can you hear me?
Yes.
Tim,
Yes.
fantastic talk. And by the way, I've just locked you in for New Zealand for 2017.
Thanks.
You can't get out of it.
Yeah.
You left us hanging there a little bit about the intrahepatic
Sure.
circulation. Can you
Sure.
please go into that? Because
Sure.
I'd be very interested in how on earth do you affect that,
Yeah.
and how you change that.
Okay, so we have a couple of minutes, so let's go ahead and go back. So we have, if you will, a design flaw. It's not really a design flaw, it's just, again, we have detox systems, but they were never designed to handle the sheer volume, amount, or type of things that we are exposed to. When many compounds are detoxified, it's done by the liver, and it's put back into the digestive system to be gotten rid of. The problem is that the intestines will reabsorb many of those compounds, right? And it does it because in that process, it also saves a lot of good stuff that the body really wants. But in the process, it ends up scooping that toxicity and putting it back into the body. So it's like the garbage man comes to your curb, grabs the can, and basically throws it back into your house. Like, not that useful. Right? So we need to find ways to hack around that and increase it. And simply put, there are really two ways. So for conventional MDs who are into this, their drug of choice is Olestra potato chips, right? So that gentleman we saw at the beginning with insulin-dependent diabetes, his therapy was two things, saunas and Olestra-coated Lay's potato chips. Now why? Because Olestra blocks fat absorption in the intestines and stops the enterohepatic recirculation, right? So yes, you get explosive diarrhea, but also you end up defeating enterohepatic circulation and getting a lot of the stuff out of your system. So we're not the biggest fan of Olestra, so is there something else we can do? And the answer is yes. Studies show that supplemental fibers are very helpful. So studies have been done on psyllium fiber, studies have been done on rice bran fiber, as two of the major ones. So often when we're detoxifying someone, we're doing these things. We're limiting their exposure. We're getting them on a nutrient-dense diet, really pushing the crucifers, the alliums, the colored vegetables. We're probably using some supplemental nutrients and herbs to help the system, making sure that they're peeing and pooping regularly. And then we're often using some supplemental fibers to help the process. Now, I'll also say, just for a moment, that gut bacteria play an important role here as well. And so we know that some of the bacteria that we don't want will go in and essentially, not to get too biochemical here, but they'll snip off the pieces that bind the toxicity so that it's more easily absorbed by the system. So another factor is if you have bad gut bacteria, you're not detoxing well. Yeah? Yes, sir.
Thank you for your presentation.
Sure.
Do you have any recommendations on testing, or is this just something that we should all be doing anyway?
Well, first of all, I say that this is something we all should be doing anyway. We know every human being, by virtue of breathing the air, drinking the water, eating the food, is exposed to these compounds. So, for example, you think the Inuit, which aren't around any big heavy industry, at least weren't, shouldn't have many of these compounds, but yet we find that they have some of the highest levels of these compounds just because of the way the currents circulate, the air and water currents, they get exposed to a lot of this stuff. So yes, everyone needs it. Now, as far as testing, there's no easy tests to do for this. There are some testing that is offered by some alternative companies. The best test would be a fat biopsy, where they take a big needle and take out some fat from you, but most people don't want to do that. So there are a few tests that are available, and if you want to talk to me afterwards, I can tell you what those might be. Cool?
So what would your suggestion be on people that do long-term fasting, like 10, 20, 30 days, like the natural health people and something like that, so that it doesn't come back? They're like the orcas.
Right. Well, they are, right? So fasting, if you look, 100 years ago was, and there's still use in some people doing it and use for it today. But if you look 100 years ago, fasting was a really big therapy. And people used to get a lot better from fasting. Now I would argue that water-only fasting, maybe not, right? If I'm putting someone on a modified fast, I'm making sure that they're having enough protein, they're having supplemental vitamins and nutrients to drive their detox systems, because we know they're going to be exposed to more during that weight loss and that fat breakdown.
Interesting.
Yeah.
Thank you.
Yep. Hi.
Hi there. Thanks for your emphasis on the preconception care. So super important. And I was just hoping you could speak a little bit to what kind of protocols you typically do with that population of people. Obviously, It depends on how toxic someone's coming in.
Sure.
But I would love to just get a little sense of how hardcore is your protocol with the preconception population?
Sure. Well, it's going to vary, of course, based on what we think is going on for that mother. So there's a lot of ifs, ands, and buts here, right? But generally speaking, the sicker she is, the more aggressive you're going to need to be. And then you try and quantify their exposure as well. So you're looking at where did they live and what was near it. We had one lady who grew up in France near a nuclear reactor, and we tested her and she had uranium in her blood, so more had to be done to deal with that. Other people, depending on where they live, if you live near a coal plant, you're going to be in a different place. If you live in a smoggy city, there's lots of ifs, ands, and buts. This general outline that I recommend here in some way, shape, or form is going to be recommended. Just the aggressiveness is going to be tailored to what we think or know is going on for that person.
Right.
Do you
Okay.
have, yeah?
Yeah,
Yeah.
no, that makes sense.
Yeah.
I mean, you just kind of have to deal with what situation is coming into.
You just
and-
have to deal with what's going on.
Yeah. And then I guess one other question, I know you mentioned kind of the 3 to 4 month of waiting time.
Yeah.
The more aggressive the protocol, would you wait longer until you want the person to actually conceive so that you're sure that all
Well-
those circulating toxins are actually out of the blood?
Sure. I mean, look, 3 to 4 months is kind of I really like 6 to 12 months,
Right.
to be honest with you. But a lot of women are like, what? You know? So you try and at least aim for 3 to 4 months. And again, the more aggressive you're being, sort of the more sure you have to be at the end of it that they're in a good place again.
Yeah.
Right? Because if you're just doing a gentle kind of detox, you're probably not pulling a lot out of the system at any one time. It's not as big of a deal. If you're really redlining them to try and get as much out, you got to make sure they're stable and everything is good before they get pregnant.
And so with the relatively healthy person, do
Yeah.
you think that gentle detox is enough?
Generally, I mean,
Yeah.
look, if it was you, for example, and you said, I grew up and I really don't have much exposure, the easily available markers that we can look at are not suggesting too much is going on with you, then sure, we put you on a 3 to 4 to 6 month protocol that's a little bit gentler, more food-based and everything else, and just work you through it as part of the process.
Okay.
Yeah.
Great. Thank you.
Uh-huh.
Hi.
Hello.
I'm curious what proportion you might attribute to what you brought up, say PCBs, what I would call maybe
Yeah.
fallout pollution,
Yeah.
versus something that's applied chemicals like Roundup, glyphosate,
Right.
which are horrible,
Right.
and also electrosmog,
Right.
electropollution. Could you maybe weigh on that and whether the detox is
Yeah.
also the same protocol for all those?
Well, look, any biologic compound that has to be processed and excreted by the body is more or less going to go through the same general pathways. And so supporting those pathways is going to be broadly helpful for anything that has to be processed by the body, right? Now, the question of electrosmog is one I can't speak to with any expertise, but we're not looking more at an actual compound inside of the body that the body has to physically manipulate to get out of the body. And so, look, in general, saying, hey, limiting your exposure to some of this stuff, eating a good quality diet, drinking enough water, peeing and pooping regularly, part of it is just everybody should be doing that pretty much all of the time. It's just goosing different parts of the process to try and stimulate it along. So, yeah, but certainly, we have stuff sprayed in the air, we have stuff sprayed on the ground, things get so people spray Roundup on their lawns, but then when they water their lawns, the Roundup gets washed then into the sewer system, and then it goes into the water at large. Right? So local applications don't really stay local, right? Yes, sir.
Hi.
Hi.
I wanted to follow up on the other gentleman's question about fasting.
Yeah.
I'm on a pretty serious detox right now with
Yeah.
cholestyramine.
Uh-huh.
And it's been recommended that once a week I do a 24-hour just water fast.
Uh-huh.
How do you feel about doing just one day out of every week?
Sure. Well, partly, look, it depends on your situation, right? I mean, if you're a strong, healthy, vital guy, and your nutrient status is really good, then sure, I'm sure one day a week is probably reasonable for you, right? If you're kind of barely hanging on by your fingernails and you're a really toxic person and your nutrient status is marginal, then I wouldn't recommend it. So unfortunately, when you're assessing these things, you're always having to look at the individual and their context and situation and the goals that you're trying to achieve. And so other than generalities, it can be hard to give people specifics without actually diving in and knowing more about what's going on. Yeah?
Thanks.
Yeah. Awesome. I think we're almost, you have a question?
I do.
Come on up.
And a request.
A request? Cool.
I'm not usually the sort of person that does this,
Sure.
so I'm a little nervous.
Don't be nervous. I don't bite,
But,
and everyone here's friendly.
Your obligatory picture of a fat person at the top of your slideshow
Yes.
is unnecessary.
Okay.
If you want to have some happy fat people in your picture, show our faces.
Okay. Thank you for that. Yeah.
And show us doing our best to be as healthy as we can be with the genetic and the chemical heritage that we have.
I apologize if it felt like I was shaming in any way.
It felt like you were oblivious. It didn't feel like you were intentional.
Okay.
But most shaming is due to oblivion and not intention, with the exception of a certain presidential candidate.
Sure, sure. Well, I thank you. I appreciate bringing it up because
Yeah.
it's not my intention, and it should be. There's a lot of
When you put
unrecognized.
obesogen in your title, you're going to get some people like me coming to your
Sure.
workshop.
Sure.
So my question is this. I certainly see the value in, for example, helping my daughter, who would be likely third generation in some of these issues when she comes to the time to preconceive.
Sure.
But what about for those of us who are now in middle age, those who are adults themselves
Right.
and dealing with these issues?
Yes.
Certainly we want to stop passing it along, but what do you suggest we do for our young adult women, our teenage women who have inherited some of these pieces from us?
Yeah.
In my case, going back at least 3 and possibly 4 generations.
Sure.
To help them out.
Yeah.
Because I can't do anything prenatally for her.
I understand. Yeah, I mean, part of it, that's kind of the gloomy piece on some level. The bright side is once we know, okay, I've got 1 minute left. We know that there is an issue. As a society, we can start to tackle it. As individuals who are dealing with this, though, it can be challenging. So if we're predisposed in that direction, one thing is to kind of go back to your first point of recognizing that, this early exposure has essentially pushed your body in a direction that, that cover model look is never going to happen. And that there doesn't need to be shame and blame, and that it's your fault, because of these exposures that were beyond your control, right?
Right.
Certainly we can get these things out of our bodies and stop the direct endocrine disruption that's going on by their presence. I don't have great answers of what can we do once our epigenome is set. Is there some way to change it? And the answer is, I don't know the answer to that question. We certainly help people try and become the healthiest that they possibly can be. We recognize predisposing factors that are there that require